As a neurosurgeon, I've seen firsthand the devastating impact of smoking on the human body. It's a silent killer, slowly wreaking havoc on nearly every organ system. We all know smoking is bad for us, but the extent of the damage, the insidious way it takes hold, it's often far worse than people realize. Despite the clear evidence, millions still light up every day. The World Health Organization estimates smoking causes over 8 million deaths annually. That's more than HIV, tuberculosis, and malaria combined. And it's not just smokers who suffer. Secondhand smoke claims over 1 million lives each year. Today we're going to take a journey through the body, exploring the impact of smoking from the inside out. We'll uncover how this deadly habit affects your lungs, your heart, even your brain. My hope is that by understanding the true cost of smoking, we can empower people to quit and reclaim their health. Let's start with the most obvious target, your lungs. Every puff of cigarette smoke delivers thousands of harmful chemicals directly into these vital organs. The delicate air sacs responsible for absorbing oxygen become inflamed and damaged. This leads to shortness of breath, that familiar smoker's cough, and increased susceptibility to bronchitis and pneumonia. Over time, the damage becomes irreversible, leading to chronic obstructive pulmonary disease, or COPD. Imagine struggling for each breath, your lungs slowly losing their ability to function. And it's not just smokers at risk. Secondhand smoke also significantly increases the likelihood of developing lung cancer and respiratory illnesses, even in children. Think of your cardiovascular system as the body's intricate highway system, transporting blood and oxygen to every cell. Smoking acts like a traffic jam, clogging arteries with plaque and forcing your heart to work harder. This raises your blood pressure, putting you at increased risk for heart attack and stroke. The chemicals in cigarette smoke also damage the lining of your blood vessels, making them more prone to clotting. This can lead to heart attacks, strokes, and even pulmonary embolisms, where a blood clot travels to the lungs. The statistics are staggering. Smokers are 2 to 4 times more likely to develop heart disease than non-smokers. Smoking isn't just a bad habit, it's a complex addiction. Nicotine, the addictive substance in cigarettes, hijacks the brain's reward system, releasing dopamine and creating feelings of pleasure. This creates a powerful cycle of craving and withdrawal, making it incredibly difficult to quit. Withdrawal symptoms like irritability, anxiety, and difficulty concentrating can be overwhelming, making it easy to relapse. But it's important to remember, the brain is resilient. With time and support, it can break free from nicotine's grip and rewire itself. Your immune system is your body's internal army, fighting off infections and keeping you healthy. Smoking weakens this defense system, making you more susceptible to colds, the flu, and more serious infections like pneumonia. The chemicals in cigarette smoke suppress the immune response, making it harder for your body to fight off invaders. Smokers are also at increased risk for autoimmune diseases, where the immune system mistakenly attacks healthy cells. This can lead to conditions like rheumatoid arthritis and lupus. Many people turn to cigarettes as a way to cope with stress, but the reality is smoking actually worsens anxiety and depression. Nicotine creates a temporary feeling of calm, followed by a crash that can leave you feeling more anxious and on edge. Studies have shown a strong link between smoking and mental health issues. Smokers are more likely to experience panic attacks, social anxiety, and even suicidal thoughts. Quitting smoking, on the other hand, can lead to improvements in mood, reduced anxiety, and a greater sense of well-being. Smoking doesn't just affect your insides, it takes a toll on your appearance, starting with your mouth. Cigarette smoke stains teeth, causes bad breath, and increases the risk of gum disease. The toxins in smoke weaken gums, making them more susceptible to infection and inflammation. This can lead to receding gums, loose teeth, and even tooth loss. Smokers are also at a significantly higher risk for oral cancer, a potentially deadly disease that affects the lips, tongue, and throat. Protecting your smile starts with quitting smoking. Want to look younger? Put down the cigarettes. Smoking prematurely ages your skin, robbing it of its elasticity and glow. The chemicals in cigarette smoke damage collagen and elastin, the fibers that keep skin firm and youthful. This leads to wrinkles, sagging skin, and a leathery texture. Smoking also constricts blood vessels, reducing blood flow to the skin and giving it a dull, lifeless appearance. Smokers are also more prone to skin conditions like psoriasis, a chronic condition that causes itchy, scaly patches. For both men and women, smoking can have a devastating impact on reproductive health. In women, smoking damages eggs, increases the risk of cervical cancer, and can lead to early menopause. It also increases the risk of complications during pregnancy, including miscarriage, premature birth, and low birth weight. Men who smoke may experience a lower sperm count, reduced sperm motility, and erectile dysfunction. The chemicals in cigarette smoke can damage DNA in sperm, potentially leading to birth defects. If you're planning a family, quitting smoking is one of the best things you can do for your future children's health. Think smoking only affects your lungs? Think again. This harmful habit also wreaks havoc on your digestive system, increasing the risk of heartburn, ulcers, and even cancer. Smoking weakens the muscle that controls the esophagus, allowing stomach acid to back up, causing heartburn and GERD. The chemicals in cigarette smoke also irritate the lining of the stomach and intestines, increasing the risk of ulcers and other digestive problems. Smoking is also a major risk factor for pancreatic, stomach, and colorectal cancers. Protecting your digestive health starts with ditching the cigarettes. We've talked about the impact of smoking on individual organs, but the most sobering consequence is its link to cancer. Smoking is a leading cause of at least 15 types of cancer, including lung, throat, bladder, kidney, and pancreatic cancer. The chemicals in cigarette smoke damage DNA, the genetic blueprint of our cells, leading to uncontrolled cell growth and tumor formation. Smoking not only increases the risk of developing cancer, but it also makes treatment less effective and worsens survival rates. The good news is, quitting smoking at any age can significantly reduce your cancer risk. It's never too late to take control of your health. We've covered a lot of ground today, and the truth is this is just a glimpse into the devastating impact smoking has on your body. But there's hope. Quitting smoking is one of the most important decisions you can make for your health. It won't be easy, but it will be worth it. If you're struggling to quit, remember, you're not alone. Talk to your doctor, seek support from loved ones, and consider joining a smoking cessation program. There are resources available to help you through every step of the way. Your body is incredibly resilient, and it begins to heal itself the moment you quit. You'll breathe easier, have more energy, and reduce your risk of serious health problems. Take that first step towards a healthier, smoke-free life. Your body will thank you for it.